Hi, this is Supriya, and I would like to share with you how, over the last 1 year, through the pandemic situation in India, Vision Empower designed some interventions for students and teachers with visual impairment in Karnataka, India.
So, to give you a brief background about Vision Empower and the work we do, we were incubated at IIIT as a not for profit organization in 2017, and we aim to empower visually impaired children through inclusive education. It's been our mission to make STEM education more accessible for students with visual impairment, especially at special schools.
Now in India, there are a large number of NGOs which work in the space of rehabilitation and support of persons with disabilities. And also, on the other hand, there is a sizable cohort of researchers who have chosen, say, design of assistive technologies, even disability studies or disability related policies as their domain of research. So, what we intended to do was to create a meaningful dialogue between these groups and work on creating solutions to address the challenges of STEM education. Also, we did not begin by creating solutions and then going and engaging with the community. We felt that the solutions needed to be created in partnership with the user community. So, research was very important for us. So, besides, it is critical to ensure the equity in terms of outreach, and we recognized that there would be no better way than the government system uh, for this kind of a large outreach. So, the first challenge that we decided to address was to create learning material, accessible learning material for students with visual impairment at schools. So, that included books, tactile diagrams, etc., because the students had none of these. Then we decided that we would work on a program with on teacher training because capacity building among teachers became a very important aspect because we were creating books which were slightly novel, which had tactile diagrams in it, and the books were created slightly differently, and so the teachers required training. And since these teachers themselves were largely about 80% of them were blind themselves. So they had not studied these subjects earlier. So they also required some support and hand holding throughout the academic year. So we created a teacher training program. We also focused on computational thinking, and I'll explain later about what we do on that because largely children have missed out on computation as a subject in the special schools. And then we also figured that technologies which are available, assistive technologies for helping persons with visual impairment to study, maybe they're available in the global north, are not available, not accessible to students and teachers in India. So we decided to create a portfolio of affordable solutions, technology solutions, which would help all our other programs. For computational thinking, we use a logic design approach, which was created by Dr. Swami Manohar and Professor Joyjit Pal. We use it to make the ACM CT curriculum, which is offered by CS Pathshala in India. We make it accessible through these games, and we ensure that all the numeracy skills that are to be picked up by the children as per the curriculum from grade 1 to grade 4, we make that available through games and game applications. And we've created a key learning area matrix where we have identified the learning indices through which these learning areas can be tracked. In addition, we have created a learning management system. It's an accessible learning management system specifically catering to the needs of students and teachers with visual impairment. And it's going to be containing all the content that we create as well as our partner organizations create and make it available to students and teachers across the country. So, recognizing the book famine for children with visual impairment and their inability to read and comprehend early on, we decided to work on a solution, which is the Hexis and Antara. Antara is the platform through which you can push any content in any Indian language to Hexis, and it's a small 14 cell light portable device which is affordable by students at special schools. We worked on this solution in collaboration with Trushe Tech Labs, IIIT Bangalore, for the design of the enclosure with IIT Guwahati, and it has now been licensed at zero cost to Wemby Technologies. Now, with all these projects ongoing, suddenly we had to respond to the pandemic when everything shut down, and we had to stop going to schools, we had to stop the training programs face to face, we had to stop, working on technology projects at our office along with the whole team. And then we had to find a new way to work with the community and first of all even recognize their challenges all over again. And what we found was that at this time when the regular schools for say sighted children went on online classes immediately, the schools that we were working with went on a long holiday, and their critical requirement at that time was that of digital literacy and also availability of devices because they lacked that knowledge and resource at that point in time. And so we felt that while we didn't have a solution ready, but it was an opportunity to research on possibilities to create some innovative programs in low resource settings. And so we shifted our research focus almost overnight to how to create online student engagements, what would work, what would not work, what would be the length of the tutorials required, whether the child had any devices or not, and if they had, then how to ensure that we created programs as per what they had. We had to modify Vict so that we could play the games that we were designing online with the children. We had to think about how to make digital literacy a reality for teachers with visual impairment. And so, after a significant amount of research, we finally started creating digital literacy audio tutorials. And then we created some online teacher training programs after the digital literacy trainings were conducted for teachers so that they could use the platforms to log into the online trainings. And then also for content generation for Hexis, we started looking at how to be able to create online platform, the content online for the Antara Hexis solution. So this was how we responded to the pandemic, and we did this along with the community. We worked with them to understand their challenges first, and then recognize the requirements, and then come up with solutions, validate them, and then try to roll out some of these solutions. So to summarize, throughout the this period over the last 1 year, we have worked very closely with all the partners who form this community of practice. We worked very closely with Microsoft Research, IIIT Bangalore, Wemby Technologies to create the solutions, and whatever we created, getting them reviewed, and we were also able to provide them with the data from the field, as we were working with the community. We could not work with large members of the community because they were in rural India and we didn't have outreach. We worked therefore with some of the NGO partners who had access to them and who were able to provide us with the required connections. We were able to work with the community in Bangalore to a large extent and create the pilot programs with them, along with them. We were able to achieve some of the government approvals and implement these solutions for the community, roll them out across Karnataka over this pandemic. So this is how it worked as a community of practice. Thank you.